coronavirus infection. The patient is a mainland resident from Wuhan, currently being admitted into the public hospital isolation ward. The government will issue guidelines which include the request for all casino workers to wear face masks. The Health Bureau believes the patient is not very contagious.
Gear up for safety. This morning, government personnel arrived at the New Orient Landmark Hotel where the 52-year-old female patient stayed. They located several people who have had contacts with the patient, including two of her friends who shared a hotel room with her. The two, alongside another friend of the patient, were brought to the Public Health Clinical Center in Wuhan for a 14-day medical observation. Their hotel room was also disinfected. The patient took a high-speed train from Wuhan to Hubei on Sunday before entering Macau via the border gate. She then took a casino shuttle bus and arrived at her hotel. The patient told the authority that she only had meals at restaurants near the hotel on Monday and spent most of her day in a casino in the following day. She walked into the public hospital emergency department last night and was immediately classified as a high-risk suspected case. The patient said she had been coughing and suffering from a sore throat for a week, but did not have a fever, nor experienced any difficulty in breathing. She was tested positive for coronavirus infection and is showing signs of pneumonia. She also developed a fever this morning. Facing the new development, the government is now in a disease prevention and control mode and has announced a series of new measures.
First, public departments will conduct body temperature checks on residents entering the departments. Our colleagues who receive the residents will wear a face mask. Also, the Health Bureau will issue guidelines requesting all casino workers to wear a face mask.
Meanwhile, the Health Bureau admitted that the current body temperature checks might not be able to identify all those who are infected.
Patients might not always have a fever. It can be said that the symptoms are milder compared to those of SARS. We cannot say that body temperature monitoring systems are useless. A proportion of patients can still be traced and identified, but not all of them.
As for the patient from Wuhan, the director estimates that she is not very contagious.
From our observation, her condition is not that serious. She has a cough and sore throat. When we were in contact with her, she did not have a lot of secretions. She also didn't have a fever. Our clinical estimation is that she was displaying early onset symptoms. From an epidemiological perspective, she is not very contagious.
But the authority is still waiting to see if the people who had close contact with her have also caught the coronavirus before determining the infectivity. If the staff members of the New Orient Landmark Hotel and Casino are worried, they can go to the public hospital for a checkup. For now, there are 60 beds in the temporary isolation wards in the public hospital. The Public Health Clinical Center in Wuhan also has 60 beds in its isolation wards, which can be expanded to 120 if needed.